Your health, your wealth. Health Unpacked is brought to you by Tebelopele Wellness Clinics.
Right, so we're going to be having a conversation today on Health Unpacked, brought to you by Tebelopele Wellness Clinic. Ribuaka, the DREAMS campaign, HIV Prevention Package for adolescent girls and young women. And I'm going to be joined in the studio today by my guests ba ileng gore ba go kgona gore ba bue ka yone kganye re tlhaloganye gore e ra eng this package, you know, what does it entail, what does it have in store for adolescent girls and young women. And I'm happy to have back in the studio me Botlhale Mosadami, medical officer at Tebelopele Wellness Clinics. Me Mosadami, good evening to you.
Hi.
I'm glad that I got it right this time.
Yes, you did.
Thank you so much for being with us in the studio.
Sure.
And let me welcome on the line Me Chawatiwa Mahlaya. Heban, ke Mahlaya. Batisani. Yes. Wow. Man, santse go tlo gona monate go go lebega jalo. Well, welcome, and I'm bringing you into this conversation as the National DREAMS Coordinator at the National AIDS and Health Promotion Agency, better known as NAPA. Good evening to you.
Good evening to you, and good evening to your listeners.
Thank you so much. So today, as I mentioned, we're going to be having this conversation on Health Unpacked. The Tebelopele Wellness Clinic has invited DREAMS, who are a collaborative partner in the health and wellness services they offer, and we're going to be talking to them in this particular collaboration and partnership, of course. You know, what are some of the key primary and secondary services offered under the DREAMS program?
The primary interventions that we have under the DREAMS program, for primary renally, so we do have the clinical services.
Yeah.
Am I audible from?
You are very audible.
Okay. Clinically, renally HIV testing, renally safe male circumcision. These are drugs that we give to HIV negative people for HIV. And then for our secondary services, safe space, we provide empowerment to young girls. The life skills. Ready to work. We are able to teach them the other life skills, baking, makeup, and the like, just to ensure that they are financially independent and not reliant on any male partner or even their parents.
Oh, nice. Okay. Now, you can maybe take us through the linkage process between DREAMS and Tebelopele. How do you work with Tebelopele?
Tebelopele is one of our partners. Idira HTC, which is HIV testing and counseling, and they also provide PrEP drugs. Yeah. So when the young girl comes in between the ages of 9 and 24 for HIV testing, they do tell her to say we also have DREAMS, which is a HIV prevention program. So if maybe she is at risk, high risk behavior. Some include sex work, some include having multiple partners. When she's eligible, but because we are also saying that when you are engaging in multiple partners, and also we tell intergenerational relations, the life skills, empowered to make better choices. Then they will link you to our other partners.
Yes.
So you see, and then our other partners, they refer them to Tebelopele for HIV testing and counseling, and also for PrEP drugs. Because we want to ensure that our young girl is HIV negative from now until 80 or 90 years old, or until.
Nice. Okay, thank you so much for that contribution. Now I'd like to engage Dr. Mosadami here from Tebelopele Wellness Clinic as the medical officer. gongwe ha ke eletsang gore wena o tsene teme mosarame ke gone gore o re bolelle the kind of clinical support process that is offered in detail to adolescent girls and young women. For example, ha re ka lebella khanya HIV Prevention Package it's offered through the DREAMS program, but let's take a clinical support perspective.
Okay, thanks so much. So we've been talking over the past couple of weeks since these sessions started about the different services that are offered through Tebelopele.
Yes.
So we by now know that Tebelopele is more like a one-stop shop for all sexual reproductive health services. So our entry point is always HIV testing. So when our young girls are brought in, remember we are a walk-in clinic,
yes,
but we also get our referrals from the different community partners, such as the ones mentioned before by NAPA. So what happens is that our young girls are screened, or they come already screened by our community partners.
Okay.
And once we identify that the young girl or woman has clinical challenges that require intervention, we then take them to our clinic side. So, for example, our first point of entry is PrEP. So if a young girl, we screen her and we find that, okay, she's at risk of actually contracting HIV/AIDS. For example, she could be a sex worker, or she could be somebody who's not able to negotiate safe sex, which is most of our young girls out there. Then we invite her to take PrEP. We've had a very nice discussion about PrEP a few weeks ago. It's a prevention pill.
Right.
It helps to keep our girls to stay negative. Remember, now we're talking ending the pandemic, controlling the pandemic.
Yes.
So we want to keep those who are negative.
Okay.
From there, we have what you call our comprehensive contraceptive package. So if we identify that our AGYW requires some kind of family planning, we then offer them family planning according to their needs that they want. We have a variety of them. We offer everything from the male condom all the way up to implant-on services in our clinic. So this is done by either myself as the medical officers, and we've got other trained professionals who are nurses. Then we have something called our post-gender-based violence services. We're identifying that our young girls are victims of sexual or emotional or physical assault. We've got a minimum care package that we offer to them. For example, we have got the emergency contraceptive, which is the morning after pill. I know a lot of people still think that this drug is illegal, but in Tebelopele, we actually offer it to those who need it. Remember that you take it within 72 hours of you being exposed to having had unprotected intercourse. So we offer it to our adolescent girls and young women. And then we've also got PEP. So for our young girls under the age of 24, if they have been victims of sexual assault or they've had condom births, they come into the clinic and we offer them PEP with the guidance that we then usher them into getting more long-term plan, which is PrEP.
Okay.
Yes. So then, of course, we also identify some of our girls who are having, who've had physical injuries, for example, and then we can actually, remember, we are a clinic, so we can actually treat their injuries. From there, we then facilitate them to our other partners, whether it's the police, whether it's a safe space, or we have the social asset building NGOs that we work with. We've got financial and mentorship as part of our DREAMS. So that's basically what we do. We do a lot.
No, you do. And I can see that you're speaking off the cuff, which I'm going to take advantage of right now in going off script. Not so much, but where a lot of times when we talk about these services, I must think that they are sort of heterosexual. The mentality is heterosexual, but there is a situation where you may find same-sex activity between adolescent girls and young women, right?
Yes.
How do they then protect themselves? Because I can see a situation where males, there are provisions for males in the form of condoms, and for the female side of things in the form of the female condom, right? But what about same-sex engagements?
Okay, so for our same-sex engagements, remember we work with a lot of community partners, and in Tebelopele we don't discriminate according to your gender or whatever your sexual interests are.
Yes.
So when you come in, our counselors are trained. Though we have different programs in the clinic, when you come into the clinic, you are just a part of us. So we work with other NGOs in the community. They can assist with women or young girls who have a homosexual or same-sex relationship, and we know there are things like dental dams. There are other protective barrier methods that we can use, and we can usher them into those programs.
Right.
Yes.
Okay.
But yeah, so we still do offer PrEP even for our young girls who are same-sex relationship, because remember that vaginal to vaginal sex is also a vaginal to vaginal method of having sexual intercourse. It's still a method of transmitting the virus.
Yes.
And actually, Truvada can be found in concentrations in the vagina within 1 month. So it's actually quite effective even for same-sex relationships.
Okay.
And it can be found in boys within 1 week.
Okay,
yes.
Interesting. And for those who just tuned in, I'm here in the studio talking about a particular HIV prevention package for adolescent girls and young women called DREAM, and we want to see how this collaborative partnership works out with Boneba DREAMS le ba Tebelopele Wellness Clinic. Chawa, back to you. What's next under the DREAMS program in terms of activities? Do you have anything planned?
Currently, we are running a road show. So next week, we are actually going to be at the Gaborone bus rank on Tuesday. And then on Wednesday, we're also going to be out. On Thursday, we're actually going to be at Lincoln Queen. So you can find us there. And then the following week, we are going to be on in Kweneng, that is Molepolo side. So do tune into our Facebook page, Dreams Botswana, and also on our TikTok, Dreams Botswana OG, and we do post our upcoming activities. And we are also encouraging because our messaging is also geared towards Bahulu, because Dreams is not just a program for young people, but we also have programming for Bahulu, because we are saying if we are giving this young person skills, empower sex partner, that could be another young girl or that could be a young male, just to ensure that their HIV prevention is continuous. And also DREAMS also targets the community. So the partner they work with the young girl in what we call the ecological model, or holistically. So we're going to be out in those districts, and then soon we'll reach out to Bomahalape, and then so we are traveling around the country.
Okay, great. Any last words from you?
My last word is just to encourage any young girl who is between 9 to 24 to say, reach out on our Facebook page. There is somebody who is always there waiting to answer you, and also link us up, and we'll also link you to counseling services wherever you are within the country, because we want to ensure that we end the HIV pandemic, and we just want to ensure that mongwe le mongwe is part and parcel of that. So if you are a young girl, kana ole motsadi already at this point, we itse gore o na le ngwana o 9 to 24, reach us, reach Tebelopele, and we will let you know who is working in what in your area, and we'll link you up with that person.
Okay, well, thank you so much, Chawa, for talking to us this evening.
Thank you so much, and have a lovely evening.
Okay, and I'm affording you the same opportunity from Tebelopele Wellness Clinic. In the form of activities.
Okay, so we're going to be joining up with our DREAMS program next week. We're also going to be part of the roadshow. So for 5 days, we'll be offering our clinical services to the community. Yes. So I just want to invite everybody out and just come and say hello, come and get some of the services. As always, Tebelopele, we have a walk-in clinic. We have what we call a girls' hub at Tebelopele, where our young girls in an environment that is very nice and pink and beautiful, and it is manned by one of our peer-oriented healthcare educators who also happens to be part of our Cookie Jar group on Facebook.
Right.
So when you come in, whether you met her on Facebook or through the Tebelopele Wellness Clinic, she'll usher you in and offer you some of the services. DREAMS is one of the programs that is very close to our heart in Tebelopele because our young girls are really our future, especially I as a Motswana doctor. I really want to see our young girls get the best sexual reproductive health services that is out there. So I just want to invite all of you guys, let your kids come in to the clinic. Come in and ask us questions. Follow us on Facebook, on Tebelopele Wellness Clinic. If you have a question, we are always there to answer it. We can make an appointment for you to come in. Okay. So see you next week.
See you next week, Dr. Mosarami. Thank you so much. And
yeah.
Okay.
Thanks.
This is how we come to the end of today's installment of Health Unpacked, brought to you by Tebelopele Wellness Clinic, by Kholagantse Karaba Tshwaraganetse Tiro le ba PEPFAR, USAID, Makgatelo mo botsogong. And we are back next week on a Thursday between 5:30 and 6 p.m. Do remember that this evening we have a family meeting. Dr. Mokgweetsi re ke abetse masisi wa re bitsa go na le sengwe se eleng gore o eletsa go se bua le rona me re sa itse tota go tile tlang hela le tlelutlwe ke dumela gore kana kwa bosupa le rona re tla ga sa molaitso ka tlhamallo jaaka lenano la Dawn at Night le simologa. So stay tuned, stay listening for that right here on Modimo FM. More talk, more music. Re tsamaela ko bokutlong jwa dilo tatatiro ya tsatsi la gompieno. And me and you will be saying goodbye to one another in just a little bit. Stay tuned, stay listening. It's Modimo FM. More talk, more music.
Your health, your wealth. Health Unpacked was brought to you by Tebelopele Wellness Clinics.